Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's video is very interesting because nowadays, because of the fast lifestyle or wrong food habits, wrong type of the lifestyle, many people are suffering from the obesity as well as the diabetes mellitus and the hypertension problem. So today we are going to discuss about diabetes mellitus and its allopathic style of management. That means we are discussing about insulin, we are discussing about the tablets, but as this topic is very large, I have divided this topic in two parts. So diabetes part 1 and diabetes part 2. In the diabetes part 1, we will try to understand the basic causes, the symptoms, investigations, and then in the diabetes part 2, I'm going to discuss about the oral hypoglycemic agent, OHA, that different tablets, their doses, their side effects, and also I'm going to discuss about insulin. So let us start to discuss about diabetes part 1 by Professor Dr. R.R. Deshpande, that is myself. I am MD in Ayurvedic medicine and MD in Ayurvedic physiology, double post graduation. I have my own Ayurveda Academy with a lot of expert doctors team, and you can definitely contact me on WhatsApp 9226810630. So let us start to discuss about diabetes. First, in a pictorial format, these are the causes of diabetes mellitus. This is type 2 diabetes mellitus. Try to understand diabetes are of two types, diabetes type 1 and diabetes type 2. Type 1 is most of the time it's like a congenital, and there is a problem with the pancreas, islets of Langerhans, the cells atrophy, cells are very less. But diabetes type 2 is a very common. Is diabetes type 1 is rare, but diabetes type 2 is very common after 40, 50, nowadays even after 30, because of the wrong food habits, lot of carbohydrates, sedentary lifestyle. So this is what you can say, the disturbance in carbohydrate metabolism regarding the sugar. So these are associated, all the things. Sedentary lifestyle. Can you see the coach? Overweight problem. Smoking is there. High fat and cholesterol level, high blood pressure. So these are all directly or indirectly contributing the problem of type 2 diabetes mellitus. Then let us see about the how you can suspect that the patient may be suffering from diabetes mellitus. Let us check the blood sugar. These are the some indicating symptoms. Monilial balanitis in elderly male. If the patient is complaining of itching of genitals after 40, after 50, there is a candidiasis, then this is basically elderly females. They are suffering from candidiasis and they get the itching of genitals. In the male, you can see the monilial balanitis. In the urethra, on the glans penis, if you get a red color, a little bit itching, then this is monilial balanitis in male, elderly male, and itching of genital because of the candidiasis in elderly females. This indicate you must check the blood sugar first to rule out the diabetes mellitus. I am not saying that will be the only cause, but that may be the contributory factor which is not giving what you can say the results to your antifungal treatment, because original contributing factor of diabetes is not nullified. Okay, then there may be peripheral neuritis, tingling and numbness of the hands and legs, or pain in both the legs. Definitely you suspect that this patient may have diabetes. Let us check the blood sugar. Non-healing wounds. This is also a very good indication that the patient may be suffering from diabetes mellitus, and that can be a contributory factor. So lot of antibiotics, ointments you are applying. Internally, the patient is taking antibiotic, but the wound is not healing. The cause will be definitely diabetes mellitus. Okay, let us see further. So repeated furunculosis, hair root infection, repeated recurrence, then suspect diabetes mellitus. Clinical features, standard clinical features, there may be recurrent furunculosis, tiredness, weakness, and loss of weight in spite of good appetite. This is very important. Patient is hungry, patient is eating, but he is losing weight. So the cause may be diabetes mellitus. Check the blood sugar. Loss of weight. There may be tuberculosis, there may be cancer, there may be HIV, there may be malabsorption, but one of the important cause is diabetes mellitus, also for loss of weight. In tuberculosis, there is a loss of hunger. So loss of hunger and loss of weight is matching with each other. Cancer also loss of hunger and loss of weight. HIV, loss of hunger, loss of weight. But in diabetes, patient is feeling hungry, he is eating well, but he is losing the weight. This paradox, this you can understand, and then this is a spot diagnosis of diabetes mellitus. Patient may complain of nocturia. He has to get up at night for 6, 7, 8 times. At night, he has to pass the urination. Then there are 3P or 3 poly. 3 poly, important words for the students. 3 poly in diabetes mellitus: polyuria, polydipsia, and polyphagia. Polyuria, excessive amount of urine, excessive amount of frequency. Polydipsia, because he is losing a lot of water and then dryness in the mouth. Polydipsia, excessive thirst. And also polyphagia, eating, lot of eating. He is eating, but the sugar is not entering into the cell. Sugar is remaining in the blood, which is of useless. Blood sugar is okay, but that for energy purpose, cells should get the sugar. And because of the deficiency of insulin hormone, that sugar is from blood is not entering into the cell, and cells are always remaining hungry, and so is eating all the time. Eating, again sugar, again eating, but no use to the cells. He is getting tired. Okay, so this is very interesting to understand. Lab test, what you can do: 8-hour fasting blood sugar. If it is greater than 126 milligram per 100 ml, you can suspect diabetes, or it is diabetes. Then 2-hour post glucose, 75 milligram, he has to consume glucon-D powder with like a sharbat. If the sugar comes greater than 200 milligram per 100 ml, that also indicates the diabetes mellitus. So symptoms of diabetes mellitus, which I have discussed previously, and if there is a random blood sugar, no fasting, no post glucose, if it is any time, morning, evening, afternoon, if it is more than 200 milligram per 100 ml, then definitely it indicates, or it is a definite diagnosis of diabetes mellitus. Whether you practice allopathy, Ayurveda, or homeopathy, I request all my colleagues that they should not hesitate to take the help of modern biophysics, biochemistry, and biotechnology. You must do the blood sugar level. Only on the symptoms you should not rely. Blood sugar examination is must. Then, if the patient is not known diabetes, that means he is not knowing that he is a diabetes, then first time the test should be fasting and post glucose. Do you understand? Not known diabetic. But if patient is already having diabetes and he just want to check the control, then it is not necessary to do all the time post glucose. Only fasting and postprandial, after eating 1.5 to 2 hours, the sugar must be checked within the period of 1.5 to 2 hours after the timing of lunch or the food. Then there is an impaired fasting blood sugar, RFG, impaired. So it will be in between 100 to 125. So it's a proneness to the diabetes. Not today, but in the next 1 month, 2 months, 6 months, 1 year, he may get the diabetes mellitus. Impaired glucose tolerance, IGT, 141 to 199 milligram per 100 ml is indicative that patient may land into diabetes mellitus. He may get diabetes within next 6 months or 1 year. Okay, so these are the risks of developing diabetes mellitus or even cardiovascular problems. Okay, so these are the types of diabetes mellitus. Type 1 is called as a juvenile onset insulin dependent diabetes mellitus. Insulin IDDM, insulin dependent diabetes mellitus. So auto antibodies, why the cause of this pathology? Auto antibodies destroys beta cells of Langerhans in the pancreas, so there is an insulin deficiency. This is juvenile. And type 2 is also called as a maturity onset diabetes mellitus, NIDDM, non-insulin dependent diabetes mellitus. That means this patient can be managed by oral tablets also, not 100% all the time insulin. But this juvenile, no, he has to take the insulin. There is no alternative. There is no tablet for juvenile diabetes mellitus. Remember the difference. It is identified at the age of 10, at the age of 12, at the age of 7, after even birth. So this is juvenile diabetes. But after 30, after 40, after 50, this is maturity onset. So usually it occurs above the 40 years, reduced insulin secretion or peripheral resistance to the action of insulin. Receptor problem may be there. The receptors on the cell, they are not enough to accept the insulin, or they are not working very nicely. Then gestational diabetes, third type, develops in the pregnancy and disappears after delivery. But this increases the risk of getting diabetes mellitus after delivery. Okay, features of diabetes 1, type 1, juvenile diabetes, commonly develops in children and young adults. This may be acute or this may be subacute of the onset. This has a complication. This type 1 diabetes may have tendency to ketoacidosis. That means if sugar is not controlled, it is hyperglycemia and blood will be acidic. That is called as a ketoacidosis. The patient can be unconscious. These patients, type 1 juvenile diabetes, are lifelong insulin dependent. There is no alternative, no oral tablet. Okay. Features of type 2 diabetes mellitus. Very common seen in 95% of total diabetic patients. 80% are overweight. So overweight and diabetes very close together. They are the two sides of the same coin. So be careful. If you are overweight, you have the chances of getting diabetes mellitus, also the heart problems. Okay. Insidious onset, step by step. It is not one day or 1 month understanding. It is gradually, it is hammering or it is hampering your body physiology. Carbohydrate metabolism is disturbed. Seen after the age of 30 to 40 years, can be managed by a tripod. I say ahara, vihara, aushadhi in Ayurveda. Ahara, that is diet control, is mandatory. Exercise should be there, and OHA, oral hypoglycemic agents, or the tablets. OHA, that means the internal tablets. Insulin may or may not be required. If you are not very peculiar about diet, if you are not controlling your exercise, then you will have to take insulin. Complications, infections like cellulitis and pulmonary tuberculosis. Short-term metabolic complications, these are very important. These are like emergencies. Diabetic ketoacidosis because of the hyperglycemia, because of the excess sugar. It may be 600, 700, 800, 900 milligram per 100 ml in your blood. When you check by the glucometer, there is only indication HL. Oh my God, what is HL? High level. That means that glucometer, your home instrument, is not showing your glucose because it is above 500. That is very dangerous. Many people I have seen the patient that they are misunderstood that, okay, their cells may be damaged, glucometer is damaged, they change the cell, but again the same HL, that is high level. With number will not come. Usually it is coming 200, 400 or whatsoever, but when it goes above limit, you understand, when there is HL on the glucometer, immediately blood sugar should be checked. It is definitely above 500. Okay, so that is dangerous. More of the days. Hypoglycemic coma is more dangerous. Blood sugar goes down. Normally it should be above 80, but if it is going 70, 60, 50, the patient may die at any moment. Be careful. Professor Deshpande is telling, hypoglycemic coma or unconsciousness is fatal. Patient can die within hour. But diabetic ketoacidosis, no. It can be managed. It should be admitted in the hospital. Then insulin drip will be given and patient will be managed. But for hypoglycemic coma, the relatives should understood what are the symptoms and signs of hyperglycemia and hypoglycemia. So this chart is very important. History, heavy carbohydrate meal, but no insulin and infection. The patient is taking always sweets. He don't bother about diabetes. High calorie diet. What hell is going to take? Then that is very dangerous because it is a silent killer. It can damage your liver, it can damage your brain, it can damage your kidney specifically, it can damage your nerve cells. So be careful. Silent killer. It will not show any symptom previously. All of a sudden, blindness. Oh my God. This is because of you are not controlling your blood sugar. Hypoglycemic, when it is taking place, missing meal. Patient is taking insulin, and all of a sudden that ajoba grandfather say, no, I don't want to eat. I am full gases and constipation. I don't want to eat. All of a sudden, insulin is already given. So that is very dangerous because missing the meal, starvation, sometimes without bothering, without eating, without taking breakfast, they go for walking and they consume, assume themselves that they are fit person. They are taking the insulin, do the heavy exercise, and that is dangerous. Overdose of insulin by accident, that is also dangerous. Hyperglycemia, slow development, but hypoglycemia, rapid, within half hour. When the blood sugar drops down below 80, 70, 60, patient is drowsy. Mother, God. Can you see my features? Immediately you will understand. And second, I am giving you clinical features. The patient of hyperglycemia, excessive thirst for last 8 days, polyuria, repeated going to the toilet, abdominal pain, vomiting. But in hypoglycemia, there will be profuse sweating. Don't forget, profuse sweating, like the heart attack. There are only the two things in our day-to-day life that you should take immediately action. Call immediate ambulance, 108. Do some first aid, call doctors. Excessive profuse sweating, your clothes are drenched, patient's clothes are drenched, and additionally some symptoms. So profuse sweating, acute weakness, tremors and palpitation, patient is becoming drowsy, you should take immediate glucometer and blood sugar, immediate, and then start immediate treatment. Immediate treatment is necessary for hypoglycemia, otherwise patient may die. On examination, signs of dehydration in hyperglycemia, dry skin and tongue. Plantar reflex is flexor, that is normal. But here in hypoglycemia, skin and tongue is moist. Here it is dry, here it is moist, and plantar, Babinski side, is extensor. Extensor, remember. Now, hyperglycemia, smell of acetone that is present in diabetic ketoacidosis, like alcohol smell, because acidic blood is there. But here, no smell like this. Sugar level very high, from 500, 600, 700, anything till 1000. Here, low blood sugar level, especially below 70, below 60, below 50, that is hypoglycemia by the glucometer or blood sugar. Sugar and ketone bodies, if you check the urine, then sugar and ketone bodies are present, 3+, and here sugar will be absent because it is low sugar. Prognosis is bad due to the complications because internally it is damaging, eye damage, kidney damage, heart damage, and brain effects. Hypoglycemia, if you treat it, no problem. Immediate the patient can rise and enjoy the life. But there is a danger of dying also. So it's crucial. If it is treated immediately, its prognosis is fantastic, superb, no problem. Okay. Treatment, test or treatment, 25% of IV glucose. When you are in doubt whether it is a hyperglycemia or hypoglycemia, give immediate 25% IV glucose. Immediate. Forget about it is hyper or hypo. If it is hyper, what will happen? Blood sugar will more and you will admit in the hospital. But if it is hypoglycemia, the patient instantly awake. You are happy. You become happy. Oh, my grandfather has saved. My grandmother is saved, because she may die if this is not done. So here 25% IV glucose can be given to any diabetic unconscious patient. This is my say. Okay, take it from me. Now, complications of diabetes mellitus, long-term complications. They are related with the blood vessels, angiopathic. Also, there may be retinopathy. Retinal vessels will be damaged in the brain. The patient can get the blindness because of uncontrol of diabetes mellitus. Neuropathy, brain and nerves are damaged. Neuropathy, nephro, I'm sorry, this is nephro resulted with the kidney. Kidney will be definitely damaged. CKD, chronic kidney disease, and patient will require dialysis. Why? Why these complications occur? The patient and relatives are not serious about the diabetes mellitus. Okay, you take the homeopathy. Okay, you take the Ayurveda. But Whatever you take, allopathy, Ayurveda, homeopathy, you should control your blood sugar level whatsoever. And that is two, that is TWO2 with three things. Number one, diet. Number two, exercise. And number three, medicines, Ayurveda, allopathy, homeopathy, yoga. Ramdev Baba, okay. Pranayama. Yes, that is good. Walking, very good. Paschimottanasana, everything is good. But blood sugar should be checked and blood sugar should be under control. There is no excuse if somebody is not doing that. Blind faith on yoga, blind faith on homeopathy, blind faith on Ayurveda, blind faith on allopathy. Even, yes, blind faith is bad. So you must keep the faith, but with the eyes open and do the proper investigations. Then macrovascular, large vessels are damaged, coronary artery disease, heart attack may be there. And especially in the diabetic patient, the problem is silent heart attack. Write down this word, silent heart attack. The patient may not complain of little tightness and pain, only sweating will be there. But yes, if you are not careful about this heart attack, this may be the heart attack, but he will not complain like other heart attack patient. Oh, no. Silent heart attack is a specialty of diabetes mellitus, so difficult for diagnosis. Cerebrovascular disease here, thrombosis, embolism, hemorrhage, brain, and then paralysis. Paralysis is a complication of diabetes mellitus, okay? Peripheral vascular disease, tingling numbness. Now, prevention of the complications, how you can, yes, you can prevent this complication. It is in your hand. Lifestyle modification. Don't be sedentary lifestyle. Always working, walking, exercise, yoga, pranayama, everything. Strict control on the blood sugar. This is the most important part. Excellent control on blood pressure also, blood pressure. Drugs, medicines like aspirin and statins can be taken or should be taken with the prescription of doctor. Prevention of complication, how you can prevent? Proper screening, proper investigations for early detection of microvascular complications. Which examinations you should do? Go to the ophthalmologist every after 3 months. Yes, diabetic patient should go without any complaint to the eye surgeon, eye specialist to check the retina specialist. This is must, mandatory. Ophthalmoscopic will be done and you will be warned, oh, there are some changes. Oh, don't worry, there are no changes. Your blood sugar is under control. Urine examination every after 3 months. Microalbuminuria. You must check this. This indicates that albumin is coming in the urine, so your kidney is damaging. Kidney is damaging. Okay. Regular foot and leg examination to avoid non-sensation, tingling, non-healing wound, fungal infections. You can avoid. So regular foot and leg examination. Advantages of exercise. It is reducing the blood sugar, reducing the insulin and oral hypoglycemic agent, that is medicines required to control blood sugar level, BSL, help in reducing the weight. In type 2, some patients can be managed only by diet and exercise. This is possible if patient is very strong to control his diet, to control lunch and dinner and food. If he is regularly exercising, his tablets, insulin will go. Okay. Advantage of exercise: increase the good cholesterol, which is called as a HDL. This is good cholesterol. High density lipoprotein. Cholesterol will increase, and also by exercise, by walking, it can decrease the bad cholesterol. And what is the name of bad cholesterol? Low density lipoprotein. Good cholesterol, HDL. Bad cholesterol, LDL. Other benefits of exercise: improvement of the blood circulation of the legs, increased stamina, and improves the quality of life. Now, calorie requirement, you must know if you want to control your weight. Normal weight with heavy manual work, 35 calories per kg per day. This is mathematics. Your dietitian, your doctor, family physician will tell you. Normal weight with sedentary life, how they should take the food, 30 calories per kg. So even you are heavy manual work, more calories you are allowed. But if it is not too heavy, Normal your work, then 30 calorie. Overweight, the patient is already overweight, obese person is there, and he just has to sit all the time, sedentary lifestyle. Then very few calories, 20 calorie per kg should be consumed. 3 indices to control your weight, to control your obesity. First, waist circumference. Waist, you have to measure. Yes, you have to measure it by the measuring tape. Main, this waist should be less than 94 centimeter, and in the females it should be less than 80 centimeter. This is called as a waist circumference to check your weight. Then waist hip ratio, in the men less than 0.9, and in the woman it should be less than 0.85. Another index, third index is basal body mass index, BMI, body mass index, that is weight in kg divided by height in meter square. This is the formula. You can now, there are lots of apps on the mobile. You can easily check your BMI, body mass index. You just give the Google App Store, BMI calculator, and you have to put the values. You can get the BMI of any person, of your friends, of your relatives. This should be between 18.5 to 30. And normally the fit person, not low weight and not overweight, that is 18.25 will be the answer in your mobile app. This you should calculate now immediately after this video. Do this job, download the BMI particular app. Then American Diabetic Association criteria to diagnose the diabetes mellitus. Blood sugars, fasting blood sugar in between 80 to 110 milligram percent. 2 hours after post glucose, 120 to 140 milligram percent. And this is the most important, glycosylated hemoglobin should be less than 6%. The number should be less than 6. Here you should remember that many people with these blood sugar levels, when they want to go to the check the blood sugar, the day before that checking, they eat less, they avoid anything wrong, and then they show to the doctor, see, my blood sugar is under control. But that is what you can say, that time limited particular readings. But this glycosylated hemoglobin will give you the average sugar control. Write down average sugar control level in last 3 months. So that is, patient cannot manipulate for this particular test. Patient can manipulate. So every after 3 months, every family physician, every relative, every patient should do the glycosylated hemoglobin test, which will be impartial, where you cannot manipulate that particular number. Okay, next, American Diabetic Association criteria, which is approved by all over the world, WHO. Cholesterol, LDL cholesterol, that is bad, should be less than 100 milligram percent. HDL, that is a good cholesterol, should be more than 45 milligram percent, and triglycerides should be less than 200 milligram percent. Then American Diabetic Association criteria, BP, systolic blood pressure should be less than 130 mm of Hg. Diastolic blood pressure should be 85 mm of Hg. My dear friends, this is the end of diabetes part 1 only. Don't forget to see diabetes part 2, where the different types of the medicines will be said. But all these are the educational videos. So disclaimer, वैधानिक इशारा, कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्य की सलाह लेना बहुत ही जरूरत है. If you anybody of you suffering from cerebral palsy in the children, arthritic problem, diabetes problem, motor neuron disease, cancer, idiopathic thrombocytopenic purpura, ADHD, attention deficit, hyperactive children, any chronic disease, any autoimmune disease, and if you want Ayurvedic type of guidance, basically we are Ayurvedic people, okay? But we have the integrated education. That's why we are making educational videos as well. So they can WhatsApp me only on 9226810630. I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel and press the bell button icon to get the interesting videos by just notification. I wish all the best and take care. Bye-bye.